Welcome to RT 330 training for clinical instructors. This packet is the purple packet that you'll see students bring in and what's included in it. The students have assignments, which I'll go over in a little bit. But first, let's look at what's given here. So they have to complete 80 to 90% of this clinical packet. I do go over it in class with them. They're supposed to be attending 7 shifts if they're at a NICU PICU location, except for students that are at Lucille Packard, they attend 8 shifts. It's their requirement. Here they will be basically, let's read from the top here, to allow students the opportunity to apply techniques, assessment skills learned in 330, and the subsequent lab to neonatal and pediatric population. So they've had actually a lab in summer already that they've learned a lot of neonatal techniques, assessment, and whatnot. They are also NRP trained, so they're allowed to go into NICU. The student will learn the practice skills, mechanical ventilation, NICU PICU, nasal CPAP, airway management, chest physical therapy, oxygen therapy, and aerosol therapy. But they need to complete this packet 80 to 90%. I'm going to skip down and come back to this page. What I mean by 80 to 90, it's a checkoff sheet for them. So there's a date and they come with an RT and the RT signs them for that day. Do assessments on 5 patients. So they go with one RT, the next RT, and so forth. They get signatures. So there are many, many checkoffs. I won't go in particular with what's going on as far as the checkoffs. They're the generic NICU PICU checkoffs. The first comes PICU, then the NICU section starts. You're really monitoring the students. Are they getting these checkoffs signed off by RTs? At the very end, I have this yellow highlighted. This is for you. You should be talking to the student about this. So describe asthma just to the clinical instructor, which is you. Describe 3 cardiac effects. They should be able to tell you how this one is, what impacts it has. So it described this with CI. This is all really verbal. Look at chest x-rays with you, lab values. So you can sign them off with that. And then capstone project, they're absolutely responsible for it. That they're doing a study for 2 days in the NICU. And I've given them a whole explanation on Canvas. They also have another assignment where they can they choose a PICU patient and write a SOAP or SBAR, not both. And you can help them with that. So let's go back to our first page here after the title page. So documentation for this is basically being done on DataArc. Students will document their daily events that they attended, a code perhaps or whatnot. And then they also should be initiating curiosity, not sitting around. And you should be talking to the respiratory therapist. Hey, how is my student doing? Anything that I should be aware of? And remember the FREPA law that I emphasize it all in our courses. You cannot discuss student information with anybody else unless it's in a private way. So say you have a student who is not coming to clinicals on time, you need to pull them aside. If there's an RT that wants to discuss the student progress with you, that has to be done without the student there in a private setting so that nobody else can hear it. There have been many cases where students complain and they use the FREPA law against the college and you. So just be careful out there. Then we also go into that every single day that the student comes into the clinical site, they do a daily evaluation. They get a daily evaluation, which I'll show you. This is the daily evaluation that the student comes with. and it has a title page, their name, the date. The student writes their goal, and then the RT gives them the comment for that day. You're looking out for comments in this section. You're also looking out for if are they really interested in learning. Students will complain that I never learned anything because nobody asked me what I was missing. So we're encouraging them that they should be taking part in their learning. So they should have a daily goal, and you should be reading the comments. So say the student is with you on day 3 for some reason, and you're the respiratory therapist. You can also look at the notes then. But what I will let you know is a lot of students like to hover over respiratory therapists to get better daily evaluations, because who doesn't feel good about getting an excellent uh, uh, score for that day? I will send you a copy of our rubric, but we know that we want our students to avoid the pitfalls that are related to unacceptable category, the needs improvement 2 category. If the student scores 2 or 1, they fail that day's evaluation. You should be aware of what their failures are. If they feel, let's just say they broke the HIPAA law, they are out of the program. They should be sent home the same day. There's any harm they're doing, safety issues, anything that jeopardizes the safety of others, the student goes home, and then there needs to be substantial documentation that you need to send me with date, which we'll also discuss in a little bit. So in this rubric, we also know that the students should come prepared to clinicals. They should have appropriate attire, not messy hair, not disrespectful to anybody, including staff and patients. Not speak poorly of other folks in the program. For example, I've had a student who was speaking poorly of their clinical instructor. We told them that they need to come see us if there's an issue. No tact, unprofessional behavior. This is about communication, condescending or incomplete report, fails to communicate with the team. We'll come back to the rubric again in another video, but this is just a reminder. You're looking out for this particular document in their purple packet and review it each time. Coming back to the purple packets, the front side where the package begins, the RTs are going to initial for the day that the student attended, sign here and with their full name, so that the student, of course, we have all probably heard that people fake it, so we want real therapist. Put their date, the student can put the date. You're also looking at the yellow card. I have a separate video that I go over the yellow card, and you can watch that, what you need to do with the yellow card. You're basically signing it off that the student was there. By the end of the rotation, you're really signing off their DataArc evaluation like always. The DataArc video is also attached in this training modules. The DataArc evaluation has to be done carefully and meticulously, specifically paying attention to if the student had any deficiency, were they notified right away? We had a student who was not notified of the deficiency and ended up complaining that they were not aware, and they're still in the program. They made it, not this year, a couple years ago. They're still around, but were they the best student? They were really, really not very, very fun to be around. But anyhow, that means as instructors, it's our job to look out for deficiency and inform the student on time and write it down in a log at home somewhere. So I want to emphasize a couple of things. You're really a student manager. If the student does whatever they do with you on the day you meet them, you should have a log at home with date and timestamp. Because if there's a student issue that comes up, I will ask you for the log so that there's evidence and I can help you and support you that way. Most students are just wonderful. We obviously know that we have to always look out for those few percentages of students that we need more work on. So as long as a student was told, for example, you shouldn't be late and they're improving, that's fine. But if it's about the consistency and showing their true character, if they're not participating properly, they're being disrespectful, it's a pattern, I must be notified. You can always text me if it's more of an emergency type of situation. We can talk. I'm always open to conversations. So the package is here. The students will complete this the while they're at any clinical rotation for NICU, PICU. At the very end, the last requirement part is for the student. It's in pink. So they know if they don't give me this information, they cannot pass. The package actually permits them to provide their license for the board exams. So there's a lot on here, but the students are aware what to do. They do your site evaluation, they do clinical instructor eval, they log in the information, so they're aware of that. I want to jump now next into what is really due for them. So the capstone project here, let's go there. So the capstone project and the SBAR assignment. So let's go over SBAR assignment just quickly. SBAR assignment, they get this sheet from me. It's actually online. They can download it on Canvas. They're supposed to fill this out for me, and they have a rubric here online, which looks something like this, where they shouldn't just haphazardly just type up information. It should be accurate, have APA format, and have appropriate information, of course, excluding HIPAA. And if they do violate HIPAA and we figure that out, the student will not be in the program. So just emphasize that as well. The capstone project has a rubric here as well for them to read. It's 50 points and they submit it to me in an essay format. It has to be a 2-day study where they look at the pattern of the patient. Preferably, definitely NICU baby would be the requirement, is the requirement. There's only been very, very few cases when during COVID we didn't have PICU cases. But NICU cases is what we want. PICU only if there's no NICU cases. Those are the assignments for RT 330, and I will see you in another video. Thank you.